How do repression and dissociation affect eating disorder recovery? Imagine trying to fix a puzzle when some of the pieces are hidden or disconnected. That's what recovery can feel like when repression and dissociation are involved. These are defense mechanisms our minds use to protect us from painful feelings or memories. Repression happens when we unconsciously push away distressing thoughts or emotions so we don't have to face them. Dissociation is when we feel disconnected from our thoughts, feelings, or even our sense of self. Both serve as ways to avoid emotional pain, often linked to trauma or overwhelming experiences. In eating disorder recovery, repression can block someone from recognizing the emotional roots of their behaviors. If they don't acknowledge feelings like sadness or anger, it's harder to process and heal from them. This avoidance can keep disordered eating habits in place because the person isn't fully aware of what's driving their actions. Dissociation makes it even trickier because it can cause episodes of feeling numb or detached. During these times, individuals might binge eat or restrict food without feeling connected to their body or emotions. This detachment masks the emotional distress that fuels the eating disorder, making treatment more complex. From a psychodynamic therapy point of view, which focuses on unconscious thoughts and emotional conflicts, addressing repression and dissociation is key. Therapy aims to help individuals bring hidden feelings into awareness. When repressed feelings are acknowledged, they can be processed and integrated into their conscious experience. This helps people understand their emotional patterns better and develop healthier ways to cope. Therapists often use techniques like grounding exercises to reduce dissociative episodes and encourage safe exploration of buried emotions. Treatment approaches that focus on trauma and phase-based recovery recognize how repression and dissociation influence eating disorders. These methods carefully assess each person's needs and tailor interventions to support emotional regulation. For example, grounding techniques help clients stay present and connected with their body. Improving emotional awareness and expression can also reduce difficulty in identifying and describing feelings, known as alexithymia, which is common in those with repression and dissociation linked to eating disorders. Overall, repression and dissociation can slow down or complicate recovery by keeping emotional avoidance and fragmentation in place. Recognizing these mechanisms allows therapists to develop strategies that help individuals reconnect with their feelings and experiences. When people learn to face and process their emotions safely, they are more likely to build lasting recovery and healthier relationships with themselves.